I'm going to show you how to prepare segments so that you can do testing on donor units. The ABO and RH type on our donor units here at SAIT have already been done. You can see this is what we have for donor units here at SAIT, so work with me on this. They have the ABO RH type up here, and the donor unit number is typically in a bright red tag here, so this one says 1488. And then when you flip it over, you'll notice there's little tags that have the donor unit number on them, 1488. And there's a little baggie that's attached to the back of the donor unit. And these are the segments that are representative of the blood that's in the bag. In the real world, these segments will be attached to a piece of tubing that comes off one of these ports at the top of the unit, a very long line of tubing that's been segmented with a heat sealer to produce these little segments. And you'll simply rip one off, and then you'll have what we have here, which is just individual segments. So when you go to the blood bank fridge to grab the segments that you require, you need to ensure that you brought with you a couple of test tubes. You're going to take one segment from one AB donor, if that's what your patient was, and one segment from a different AB donor. Typically we prepare 2 donor units for our patients. So from the back, I'm going to grab one of the labels and stick it right on my test tube. And I'm going to take 2 segments from this bag, simply because I want to show you how to open a segment using a segment piercer, and I also want to show you how to open a segment using scissors. But remember that you'll take segments from 2 different units. So I'll grab the segments. Remember that once you get the segment out of the bag, you're toast as far as figuring out what the donor unit number is on these segments. It's not written right on the plastic. So please stick your segment immediately in the label tube and carry your segments back to your work position. Ensure that the donor unit of blood gets put back in the blood bank fridge, because the blood needs to be refrigerated and it can't sit out while you complete your testing. Okay, so I've got my donor segments, and I'll show you how to, I guess I'll show you first how to cut the donor segments. So we have a choice of using a segment piercer, which is the little blue device that you probably have sitting at your workstation right now, or we have a choice of using scissors. So I'll show you scissors just because we sometimes don't have piercers and we have a need to use scissors. So I'm going to cut the top off of the segment and ensure that it falls into my biohazard bucket, or it can fall into your biohazard discard that's below the bench there. So just cut very close to the top. Ensure you have face protection on. It's as simple as that. So the top has now been cut off. Now I'm going to turn the segment over and insert it into the tube. You'll notice that the blood doesn't run out, and it's just like having your finger on top of a straw. The liquid will not run out until we take our finger off the top of a straw or cut the top. So get ready with your scissors to cut the top. And you'll notice that the blood ran right out of the segment. If it doesn't completely run out, you can do kind of a toothpastey, squeezy type of thing until you get the liquid out. But what I've got in this test tube is more than sufficient. So there you go. That's how you get blood out of the segment using scissors. Now this blood that's in this tube is not 5%, and it's definitely not washed. So donor segments need to be washed at least 3 or 4 times and then made up to typically 5%. So please consult the insert for whatever testing you're doing on the donor unit so that you know what to do with the donor unit, but they typically need to be washed. I'm going to show you how to do the same thing, this time using a segment piercer. So this is a great little device that has a very sharp needle in one end. You can't really see it, I don't think, but you may be able to see some funnel-like striations, and it's like a little funnel and there's a needle at the bottom. Now, even if I stuck my finger down there, I couldn't get hurt by this because it's quite buried, but we treat it as a sharp regardless. Then you'll notice on the other side that it's flat. So it's this flat side that sits on top of the test tube that you're delivering your segment into. Okay, I don't think you could do it the other way because it wouldn't fit, it would just fall off. So flat side sits right on top of your label test tube. I'm going to take my segment and push it into this funnel-like device. You can push in the bloody end of a segment or the plasma end of a segment. It really does not matter, you guys. So whichever one you get to is totally fine. So just push the segment into the funnel-like device. Push down hard. You might hear a little bit of a noise. I don't see any blood collecting in my tube at the moment. So I'm going to use the toothpaste type motion, just squeezing the tube and folding it down like you would if you're running out of toothpaste and you just had to get one more use out of it. There we go. So now I've got lots of blood in my test tube. And I'm just going to take this whole thing, the segment and the segment piercer, take it right off and throw it in the biohazard waste below your bench area. So there we go, we've got donor cells into our label test tube, and once again, they will need to be washed a minimum of 3 times and typically made up to 5%.